Hey guys, it's Dr. Oob here. I'm in the ER in Yoakum, Texas, and I've had somewhat of a depressing day, and I felt like I had to tell people about what they can prevent. I had to pronounce a man dead today. He was in his 50s, and modern medicine, conventional medicine, failed him. He most likely had a large heart attack today, and he didn't survive. And he was just in the hospital a week ago for chest pain, and they ran all the tests on him, the typical tests, and said everything was fine, and so he was discharged from the hospital, and a week later he's dying in the ER. Guys, this is preventable, this is detectable. Modern medicine and conventional medicine is not testing inflammatory levels. If you are not testing your inflammation levels, then you are not doing an adequate job. If you're eating a bad diet, inflammatory foods, eating a lot of sugar, eating processed foods, then you are creating inflammation and you are at high risk for heart attack. Now, if you do your inflammatory markers, you can detect and see these early markers that are happening. This guy was not a typical heart attack patient. He was overweight, but he was not obese. He wasn't a smoker. He was a father. He was a husband. He was a worker, and he ate the standard American diet. And he now has some very disappointed family members. Did you know that 30% of people that have heart disease, their first symptom of heart disease is death? That's a scary fact. You want to know another fact that's also scary? Is 50% of people that have heart attacks have perfectly normal cholesterol levels. Yet if you go to a conventional medical doctor and you say, I'm worried about my heart health and I want to be checked, they're going to check basically one thing: your cholesterol. And if your cholesterol is high, they're going to put you on a statin. That's not necessarily how you save a life. That's not necessarily how you live longer. It's all about the inflammation. It's about the sugar you eat, the food you eat, the exercise you do every day. So if you have a loved one that you're worried about their heart disease, get them checked. The inflammatory markers that are easy to check are HSCRP. You can get that at any local lab. Now, in my practice, I do more of the advanced testing to look at the LP-PLA2, myeloperoxidase, F2-isoprostanes, oxidized LDL, and other inflammatory markers that are even better predictors of if you have inflammation in your blood vessels. This is all treatable. This is all reversible. So don't let yourself or a loved one be the next 50-year-old in an emergency room dying from a heart attack that could have been prevented. Not a good day, but hopefully this information helps you or helps a loved one change their life.